I'll just introduce in the meantime. He's a board member and treasurer of Israeli Society of Contraception and Sexual Health. He is also the board member of European Society of Contraception and Israeli Menopause Society. He is attached as a senior doctor in Maccabi Health Centers in Israel. He's an editor, board member of several forums and journals, and a reviewer of medical journals, including the Journal of Obsgynec and Contraception. He's a participant in guideline statement papers published by the Israeli Medical Association and serves as advisory boards of several pharmaceutical companies. He is the author of many best-selling popular books. Ladies and gentlemen, Dr. Amos Ber.
I have to take the two most important events. One was, of course, the human IVF in 1978, and the second one was actually the ICSI, which came in 1992. All the rest are important developments, but this, I think, are the major ones. So we started in 1992 to do ICSI, the intracytoplasmatic sperm injection. And soon after, I wouldn't say soon after, but in a time, started to appear articles showing that maybe there is increased birth defect. And this reached also the popular press, and you see in 2012, birth defects risk seen in assisted conception. This is the New York Times. ICSI fertility treatment linked to birth defect, coming from Australia also in 2012. And this is all due to a retrospective cohort study using data from 3 population-based registries in Australia. And major birth defects were diagnosed in 8.7% of IVF and ICSI singletons, and 5.4% of non-IVF ICSI singleton, odd ratio of 1.53, which is a huge increase. It's okay, I'll be holding it so it won't fall. And you see immediately the male online IVF treatment used by 23,000 women in turmoil as shock report reveals that birth abnormality have doubled. So this became already a shock report last year. And doubled, of course, makes a lot of noise. This is the article of Davis published in the New England, where the assisted conception consensus in South Australia was linked, census in South Australia was linked to registry of birth and termination with gestation period of more than 20 weeks, or embryos weighing more than 400 grams, and registries of birth defect. Of the 308, almost 309,000 births, 6,163 resulted from ART. They had 513 defects, which was 8.3%, and pregnancy not involving ART had 5.8%, which is a huge difference. The odd ratio for any birth defect, the unadjusted, was 1.47, and the multivariant adjusted was 1.28. So actually, when we look at IVF, we see 1.25 unadjusted odd ratio. When we look at adjusted ratio, it was 1.06, which was non-significant. But when we look at the ICSI, we had 1.72 and adjusted 1.55, which was meaningful. What is the mechanism behind the possible association of ART and birth defects? So, effects of controlled ovarian hypostimulation, the in vitro sperm preparation procedure, the inherent genetic defect related to infertility, and in ICSI, the sperm artificially selected and injected into the oocyte. How can the ICSI be associated with the increased risk? The invasive nature of this procedure may directly damage the spindle or insert toxic substance. Of use, we can choose the sperm, and of course, when we choose them, we can use extremely poor sperm, or other factors related to severe male infertility may underline this association. The mechanism between the possible, if we look again, so it's the defects in DNA methylation and genomic impairment might be caused by the embryo culture that follows the IVF, and it's supported in recent literature. The association between IVF is shown to be with the Beckman-Widman syndrome, the Engelmann syndrome, and the retinoblastoma. When we look at frozen cycles, so you see that when we look at IVF, we have got 1.24 with 1.08 adjusted ratio, and when we look at ICSI, it's exactly the same. The difference which we saw before disappears. So why do we see less malformation among cryopreserved embryos? Reduced likelihood that the developmentally compromised embryo will survive the thawing process. And maybe the temporal separation of the developing embryo from the exposure to the hormonal stimulating drug also plays a role. So is it the ART treatment itself, or is it the group of patients that we are treating that we know that they do have a problem? Because when we look at those patients, and we take patients undergoing only IUI, okay? Which means that they've got fertility problems, but actually we are doing nothing except IUI, you see that the rates of adjusted odds ratio are very high for birth defects. Even spontaneous conception after previously birth from assisted reproductive technology is also higher. And infertile without history of treatment with assisted reproductive technology is 1.37, which means there is not much difference. So the increased risk of birth defect associated with IVF was no longer significant after adjustment for prenatal factor. The risk of the birth defect associated with ICSI remained increased after multivariant adjustment, although the possibility of residual confounding factors cannot be excluded. The risk was increased in women with a history of infertility, but no accompanying history of treatment with ART. So maybe we need a meta-analysis to start resolving this problem. So there are two meta-analyses. One is this one published in 2012. They tried to conduct a meta-analysis of studies assessing the effect of IVF and ICSI on birth defects. They finished up from 925 citations, they finished out with systemic reviews. 556 systemic reviews were also included. And birth defects in IVF and ICSI versus spontaneously conceived children was 1.37, which means we saw a higher rate of birth defects. When we compared IVF, when they compared actually IVF with ICSI, there was no difference in this meta-analysis between ICSI and IVF, what we thought that we saw before. It was 1.05, non-significant. So the conclusion were that children conceived by IVF and or ICSI are at a significantly increased risk for birth defects, but there is no risk difference between patients undergoing ICSI or undergoing IVF. In the case of ICSI, but not IVF, the increased risk of birth defect persisted after adjustment for maternal age and several other risk factors. The possibility cannot be ruled out that other problems that exist in patients of going on fertility problems can explain this observed association. This is a second meta-analysis published in 2011. They tried to separate the risk of major malformation in ART offsprings attributed to subfertility from those attributed to ART itself. And the adjusted odd ratio for 18 studies, those marked with C, they are combined results, those marked with V are IVF studies, and you see that the overall was 1, which means there was no increase. The conclusion of this meta-analysis was the adjusted analysis suggested that the relative risk in the offspring of ART-treated couple is not statistically significant and does not differ from between them and between other articles. After adjusting for subfertility, they also found not increased risk. With regard to major malformation, ART may seem safer than originally thought. That was their conclusion. Not only was the odds ratio, the overall ratio 1, but as you can see, there were 5 articles. There were 5 articles. There were 5 articles which showed less risk of malformation. So can the ART actually decrease the risk? Protective effect was observed in 5 of those studies. Improved selection in the lab maybe of the sperm, of the embryos, shorter TTP time, all those might have contributed to those results. Limitation of studies on those fetal malformations and ART, they are usually small articles, pooling of exposure groups, duration of follow-up, the methodology, the case control studies, most of them are retrospective studies, and we know that a lot of those women we are treating are older, they have multiple pregnancies, and sometimes when you compare them, you don't get the right controlled groups. So the appropriateness of the control as a group, usually ART patients, as I said, are older, they have higher socioeconomic status, they've got lower parity, more multiple births. Another thing is that the quality of prenatal detection may also bias birth defect report. Infertility couples are less likely to terminate pregnancies where some malformation might occur, which might have been terminated by normal couple which have no problem of getting pregnant. Neonatal screening is more secure with those patients, and duration of follow-up. What about heart defects? Is the rate of congenital heart defects detected in in those pregnancies higher? So here we see 3 articles which show us actually that major cardiac heart defects are increased in patients with IVF and ICSI. Here, fetal echocardiography was performed in 700, almost 50 consecutive IVF pregnancies. The frequency of heart defects was 1.1% per IVF pregnancy. Compared to some early historical population data, IVF pregnancy had a significantly higher risk of cardiac heart defects. Compared to more contemporary population data, there was no difference in this rate between IVF and naturally conceived pregnancies. Of course, like expected, IVF twin pregnancies were as much as 12.5 times as likely to have cardiac heart defects compared to the general population. But once again, we know that twin pregnancies have, in general population as well, they've got much higher cardiac defects. So if we have to summarize the recent studies, the risk of fetal malformation are not higher in one article for IVF and ICSI. In another article, they are overestimated. In another article, we have got more malformations in ICSI than in IVF. And others show us that there is no difference. So actually, you've got all the range of everybody getting to different conclusions. So if we would have to conclude it, we have to summarize, I would say that the history of infertility, either with or without assisted conception, has been found to be significantly associated with birth defects. So we are dealing with a special population. And the risk of fetal malformation with ICSI not confirmed in all studies. It remains to be determined whether IVF with or without ICSI is associated with an increased risk of fetal abnormalities, or is it to a large extent a reflection of the unique parental characteristic of the couples that we are treating that require actually those infertility treatments. Thank you.